So when we think about the JAMS protocol, which stands for Jaw, Joint, and Muscle Sprain and Strain, there are two really important pieces of this. One piece is the assessment piece, that we can use this information in this protocol to assess our patients and figure out on the front end whether we would put them in a low, moderate, or high risk category for developing jaw, joint, and muscle sprain or strain. And that then allows us to go through a series of protocols to prevent that from happening, so that as we move into actual restorative appointments with our patient, we know the risk that they present, we know the risk of a particular procedure, we can put that information together and we can follow a series of things to make sure that we keep the patient as comfortable as possible and that we prevent the possibility of them having a post-op complication that involves their jaw joints or their muscles. The logical place to discuss S.A.F.E is from the beginning, S. So S stands for Set Up for Safety. And when we think about set up, we're thinking about that both from a human resource perspective and from an actual physical resource perspective. So human resources would be all of us, the dental team. So part of Set Up for Safety is making sure that every member of your dental team has the information that they need to help be part of this process and preventing jams. That includes the person in your office who answers the phone, who might take a new patient phone call and can ask pre-screening questions before they get onto the schedule. To the same person, or maybe a different person, is going to interact with patients on the phone after an appointment. That may be because they're proactively doing follow-up phone calls to check and see how a patient is doing, or because a patient calls in saying, hey, here's what I'm feeling. Is this something that I should be worried about? So those folks need to know to listen for the things a patient will say if they're starting to experience jams, and how to ask questions that the patient may not be giving voluntary information about. The same will hold true for every member of our team. So that's our dental hygiene team, our dental assisting team, and of course all of the doctors in the office. So we really suggest thinking about how we get this information to our team members. That's one of the things these videos are for, is you can invite your team to come on and to work their way through these videos. You can also do it in a more structured format and set up a team meeting or a team training time, and you can go through the videos together and have a chance to dialogue. But we want to make sure that every member of the team knows moving forward, jams is part of what we do in our office. We're going to screen and treat, and we're going to use S.A.F.E as part of that protocol. The other part of S, or Set Up for Safety, is making sure that we have all of the tools we need so that we can be part of preventing and treating jams in our practice. Those could be simple things like range of motion guides. We're going to have a little video on how to do that. It could be having quick splints in our office. It could be making sure that we have processes in place to schedule those appointments that are long enough for patients to have rest periods. So as we go through this, one of the things to do as you watch the videos is to start to make yourself a list of things that you might need to acquire as you want to implement this in your practice, or conversations that you need to have with your dental team to make sure that we have the JAMS protocol in place in your practice moving forward. The second component of S.A.F.E, assessment. So when we think about assessment, we're going to assess two different things. We're going to do part of our assessment on the patient. We need to know if they're going to show us risk factors for jams. And then the second piece of that is assessing or thinking about our dental procedure. So let's go to the patient first. We start our patient assessment with a jams assessment questionnaire. We actually have separate videos on going through that assessment with a patient, so you can watch me actually have that dialogue with a patient, as well as the next piece, which is measuring range of motion. So when we think about range of motion, what we want to do is find out at a comfortable opening, is the patient in what we would call the low risk zone from 40 to 60 millimeters, or are they going to be in a higher risk category, below 40 millimeters, above 60 millimeters. And those are two simple ways we can start to see, is this low, moderate, or high risk. The next piece of the puzzle is to look at the procedure. This is probably going to seem pretty self-explanatory, but when we think about a low-risk procedure, we're going to think about procedures that are very short duration, that are definitely more anterior in the mouth so that we don't need to ask the patient to open their mouth as long. We're going to think about procedures where we're putting less stress on the lower jaw. We're not pushing down and forcing that patient open. So what we do is we put those two things together. We put the patient's risk factors together with the procedure's risk factors, and we're going to put that in one of three boxes: low, moderate, or high. If a patient and the procedure together fall in the low risk assessment box, we really are not worried about the potential for jams to develop. As soon as we have a patient and a procedure combination that has us thinking moderate to high risk for jams to develop, now we have pretty simple management strategies we can do that'll actually prevent jams from happening and also set us up to evaluate post-operatively in case jams presents itself, so we can get very quickly to treating. We call it speed to treat, which is a significant factor in preventing long-term problems. So when we start to think about moderate or high risk, what are we looking at? We're looking at patients who answered their assessment with a lot of yes answers versus no answers. They already are telling us they've had a history of problems around their jaw joints or their muscles. We're looking at patients who have a range of motion that's less than 40 or greater than 60. Procedurally, we're now starting to talk our longer appointments. We're talking about procedures in the posterior part of the mouth or procedures that put a lot of pressure on the mandible. So if you're already thinking about, well, in my practice, I do a lot of longer procedures. That's one of the things I'm passionate about is cosmetic dentistry or more complex reconstructive, restorative dentistry. I'm watching this as an oral surgeon or a periodontist, and those procedures are what I do day in and day out. One of the gifts of JAMS protocol is that instead of having to manage that at the back end, you're actually preventing it at the front end. It's a much more efficient way to practice. It's also much better from a patient management and patient health perspective. So what we're going to do next is we're going to actually talk about how we manage those specific moderate and high risk patients. So like everything in dentistry, when we think about jams, preventing it from happening, to me, is much more important than being able to treat it once it does happen. So I want to talk about management right now for patients that we've put in a moderate to high risk assessment category based on their preoperative findings and the procedure we're about to do. And it's a list of things that you can choose from, almost like a menu, and decide what you want to do for your patient. And there are a few of those that we really think are very important, and I'll stress that when we get to those. So when we're thinking about a patient who's moderate to high risk, one of the first things that I think about, and to me this is important, is to schedule enough time that I can give the patient breaks to rest their jaw. So instead of doing their appointment in the minimum amount of time I can get it on the schedule, I know ahead of time I'm going to need to stop and let them close and rest their jaw, and I've got to schedule that time in so that that appointment is not stressful for them or stressful for us as a dental team. As part of being able to take those rest periods, I really need feedback from the patient. So I'm going to invite the patient to tell me, raise their hand or get my attention or the assistant's attention if they feel like they need a break, that it's time to rest their jaw. I can also think about having that patient rest their jaw on a device like a quick splint. So when I think about a patient at risk for jams, a quick splint is really at the top of my list of incredible tools that help manage, prevent, and treat. If I have the opportunity and I've actually done the risk assessment before the restorative appointment, I will actually make that patient a quick splint and I will send them home with it, and I will actually ask them to sleep in that quick splint for several nights before their appointment so that when they come in, they're already coming in with those muscles a little less fatigued and everything a little bit calmed down, and then I'll ask them to bring that quick splint with them. Whether they're bringing it in from home or I'm making it the day of their restorative appointment, I actually like to make that at the front end of that appointment. So in those rest periods, I can actually have them rest on their quick splint, and that's a device that's designed to make the back teeth not touch, which decreases the activity of the elevator muscles and therefore is giving those muscles the maximum benefit of resting as well as taking some load off of that jaw joint. And then I'm always going to send my patients at moderate to high risk of developing jams home with a quick splint. And we're actually going to give them some specific instructions that we can get along with the quick splint that tell them to wear that device as much as they can in that first 7 days after the appointment, to then go to nighttime use in that second week. And part of that for me will be, we're going to invite that patient back. We're going to be intentional about recalling them for a 7-day post-op appointment. Because one of the challenges of jams is that when patients develop it, they don't call their dental office and come back to see us. Most of them end up in an urgent care or at an ER at their primary care physician. They get caught up in that system of trying to get rid of their symptoms. And instead of speed to treat, by the time they end up back in the office of the dentist or a TMD or a facial pain specialist, we now have a chronic problem. So I want to be intentional. Another way to be intentional is to follow up, have a post-op call. So whether you make that as the dentist or you have a member of your team call the patient the next day or 2 days out and just check in with them and ask how they're doing, and even ask some of the same questions you did on the JAMS assessment questionnaire to find out whether or not they're starting to have any early symptoms of JAMS. That gives us that chance to speed to treat and get in there efficiently and effectively. There are some other things that I do on my list. One I want to touch on is going to sound counterintuitive, but it's very important. And that's for patients at moderate to high risk of jams. We don't want to work with a bite block. I know it sounds counterintuitive because you're already imagining these are the patients who have trouble opening their mouths and their lower jaw could be a little shaky, and it makes what we do challenging. Unfortunately, working on a bite block now is going to isolate those muscles. It's going to hold them in that contracted space. They have much higher likelihood of those muscles now spasming and having inflammation. It also eliminates some of the obvious visual cues that we would experience that the patient needs a break, like their mandible trembling a little bit or them having an increased problem holding their mouth open, as well as it doesn't give the patient that opportunity to give us that feedback. So if it is a patient that you're worried about whether or not they can open, and those patients may be in your high-risk assessment, that's a place where you might want to actually treat that patient or manage that patient ahead of the restorative appointment so that you can eliminate a lot of those problems, and then do your restorative appointment where you can do it without feeling the need to use a bite block. There are some other things we can now think about from a management strategy. One that comes to mind for me is having the patient pre-medicate with 400 to 600 milligrams of an anti-inflammatory an hour before their appointment. So you could use over-the-counter medications to do that, like Advil, Aleve, ibuprofen, or you could write them a prescription, as well as giving them the instructions following their appointment to make sure that they stay on something anti-inflammatory. And I do know that that will also manage some pain, but we really are thinking about it from an anti-inflammatory perspective. We can also think about things like heat and ice, or hot packs and cold packs. Those are things we can do in our office. Often for us, when we have a patient who we already know is at risk of jams, we're already prepared that when we're taking our breaks, we're going to ask them, and we might apply some warm, moist heat. We might give them a heat pack that we do in the microwave, or we also might alternatively apply a cold pack for them. And I typically ask them which of those they think is going to feel most comfortable. So that can be management during an appointment as well as management after an appointment. So lots of strategies to start thinking about. There are also some advanced devices that you can look into that actually support the patient's lower jaw. So that if you are doing a procedure where you're going to put a lot of downward pressure, especially in a high-risk patient, you can actually support their mandible. And I'm sure there are other things that you can think of as you go through this that you're already, as I'm talking, thinking, you know what, if I did this, I bet that would work. Often, if a patient has an occlusal appliance, you might invite them to bring their appliance with them, and they can actually put their own appliance in during those rest periods. So you could see we could kind of brainstorm about this. But I want you to definitely make sure that once you know the risk assessment, you're thinking about have enough time. Make sure you've factored in rest periods. You've factored in the ability for the patient to give you that feedback. You're going to send them home with a quick splint and instructions for how to manage things over that first 7 to 14 days after the appointment. And we're going to make sure we have a way to check in with that patient so that if they are developing any early symptoms, we catch it as quickly as possible. So the last piece of SAFE is E for evaluate. Let's talk about what that means, and there are several pieces of this. I want to think about evaluate intentionally. So my patients who are at moderate to high risk for developing JAMS, we're going to set up a way to check back in with that patient and find any early symptoms of JAMS. I've already talked about 2 ways we do that. One is when the patient leaves, we're going to set up a separate post-op appointment for them to come back in 7 days. Now, many times our procedures require a second post-op appointment. So many of you know if you're doing cosmetic dentistry, you bring a patient back so that they can tell you how they feel about their provisionals or their temporaries. If you're doing occlusal equilibration or you're adjusting appliances, you're very accustomed to bringing patients back so they can tell you if their bite still feels okay or it needs a little tweak or an adjustment. So I really want you to think about JAMS the same way. These are patients where with intention, we need to have them leave our office with their next appointment so that we can have them back in and evaluate and say, how are you doing? And at that appointment, we're going to go through our JAMS assessment questionnaire and we're going to screen for those same things we did in our initial risk assessment. Now, another piece of being intentional is to actually follow up with that patient. We can pick up a phone and call them and say, how are you doing? And again, this is routine when we think about certain dental procedures. There are many of us who call all of our patients who've had any significant dentistry at that 24-hour mark. We call them that evening or we call them the next day. And if we're already doing that, we simply have to think about asking a few specific questions so that we can listen for the signs and symptoms that JAMS might be developing. So not just saying, hey, how are you doing after today's appointment, but specifically saying, are you noticing any pain in and around your face, around your jaw joints? Are you having any trouble opening or closing your mouth? So we're going to be intentional about that. If in your practice you make post-op follow-up calls for specific procedures, and that might be a patient who had a surgical procedure today, they might have had a large crown and bridge appointment, we're going to ask that you add your patients at moderate to high risk for JAMS to the list of people that your front desk is going to say, there's your list to call tonight or tomorrow. And it doesn't always have to be the dentist. In many offices, we actually have a member of our team who does those follow-up calls. And that person simply needs to be well-versed in JAMS and needs to understand the questions to ask during those follow-up calls. So just like we have other patients and other procedures that for us mean this person gets a follow-up call, our moderate to high-risk JAMS patients are going to get added to that list. Another really important piece of the E is that whoever in our offices answers the telephone knows how to listen to those signs and symptoms of JAMS when they take those post-op calls. So often what happens is after a procedure, a patient calls and says, my jaw's a little stiff, my jaw's a little achy, I have a headache. And what they get on the telephone is, take some Advil, take some Tylenol, rest, that's normal, it'll probably get better in a few days. And those are things that we want to make sure instead of doing that we're actually asking specific questions. We're getting that information. The person on the phone can actually go to the JAMS assessment so they know what questions to ask, and that information is actually now turning into the person on the phone saying, we need to see you. Come in because we're going to do a post-op appointment. Or at least that information is going to get to the dentist and they can say, let me share this with the dentist and let me find out if there's something we can recommend you do at home, or if we feel like we need to see you. What we don't want to have happen is that person falls into the gap where it sounds like normal routine post-op, and then it doesn't get treated speedily, and they develop some larger problems, or they feel like, I'm not going to get a solution at my dental office, so now I need to go to that urgent care or to that ER. So that's going to be an important piece of that. as well as when we do have those patients in our office for that follow-up, that post-op or that evaluation, that with intention we're going to go to our quick, easy JAMS assessment system, and we're going to use our assessment questionnaire, and we're going to re-measure our range of motion, and we're going to have physical indicators that yes or no, this person's doing great, or we actually need to treat now because they have developed JAMS.